I'll say a little bit about Morgan Health, a little bit about what we're doing, and then kind of how I think it connects into the health system environment. Because in a lot of ways, what we're focused on are the patients who are your patients, but they're our employees. And so there has to be a bridge between kind of those two worlds. And I think so oftentimes, like, we're all focused on the silo that we're focused on and not thinking as broadly about how to kind of improve the patient experience. So we are a business unit within JPMorgan Chase. Our mission is to drive better employer-sponsored healthcare, and we measure that quality, affordability, and equity are the three things that we're trying to accomplish. And what we're doing is true double bottom line investing. So we've made now 9 investments. We're about to announce our 10th, which I'll talk about a little bit later. But we've made now 9 investments, and for every investment, we have performance indicators that are non-financial. So it might be improving cholesterol or improving diabetes care or better access to health data by employers. And so all of those things become our performance indicators, and then we also track financial performance. We are blessed in the sense that we are investing off of the balance sheet. The balance sheet of JPMorgan Chase is significant. We are tiny. And so the mission aspect of it is really what has motivated the senior leadership team here to want to do this. And I think we're making really good progress. This work is slow, it's painstaking, but I think we all of us have been in it long enough to understand that is going to be true. So how are we doing what we do, and why do we sit within a bank? If you think about the JPMorgan Chase ecosystem, very, very accomplished in AI, very focused on transactional, very focused on data integration. And so there's a lot about data that we have access to here. And our portfolio, we will have 10 companies. 8 of them are very deeply into AI and data integration. And we actually bring in the resources from the JPMorgan Chase data teams, I should say, because it's different. There are many different data teams into the mix. We're a large employer. We spend about $2.5 billion a year on healthcare, so it makes a difference if we're able to affect the cost trajectory. So that's kind of another aspect. And then we think we know how to accelerate companies, and that's what we do. It's what I've done personally for my career. It's what our team does. And so you kind of bring those things together, and before we invest in a company, we want to know that it'll achieve the mission. We also want to know that we can make a significant difference in accelerating the work of that company. So what are the focus areas for us? They're really reflective of what is happening in the employer market. So when John said, kind of the focus on employer markets, there are really 3 things that I would tell you are kind of top of mind for employers right now. One is the obvious, which was the subject of both the New York Times and Wall Street Journal articles in the last week: cost acceleration. So we'll see cost increases of about 10% this year. We bank about half of the small businesses in the United States. They will see increases in the 15 to 20% range. It's completely unsustainable. And I mean, you all know why it's happening. And I think that there's kind of a cognizance of, and it's everything from GLP-1s to more clinical care. We do a lot of analytics around why costs are going up, and that does inform our investment theses. And then it also drives us to certain investments. So for example, Centivo is an early investment that we made. I don't know if anyone's familiar with the company, but basically what they do is they go into a geography, they establish a relationship with a leading health system. So in Dallas, for example, it's Baylor. And they create a narrow network plan where the employer offers a narrow network plan to employees. It could be side by side with a broader network, which is how we run it in Dallas. But by essentially creating that narrow network, the cost of the product is probably 20% less than what a standard insurance product would be. And by the way, it also addresses some of the biggest problems in the healthcare system, which is kind of my number 2 point, which is fragmentation. Patients don't know how to navigate the system. It's so complicated and frustrating, and there's been a lot of focus on denials. I think there's been less focus on how fragmented things are and how difficult it is for a patient to figure out where to go. That has been our investment thesis in a lot of ways with a number of our companies. But what results from that is that employees are very frustrated with these standard insurance products. And so, for example, I'll tell you that like our benefit, which is it's an excellent benefit. It's JPMorgan Chase. Our employees get to choose between Cigna and Aetna, has a net promoter score of like -8 now, because of all the denials and the systems issues. And let's be honest, it's like they hit that friction. So one of the things that we did was with our portfolio company Apri, opened up a model that kind of sits on top of that, where we have on-site primary care, prevention, engagement with the patient, and also care navigation. And we're running that right now in Columbus, where we have about 40,000 employees and dependents. And that product, the way that we're operating it right now, has a net promoter score of 88. The employees love it. They feel like someone's there to take care of them, someone's there to help them navigate. And I'll tell you also that one of the reasons why it's doing well is because of our partnership with Central Ohio Primary Care, which is a great primary care facility in that area. And so like the partnerships are very, very important for us. And then kind of the last thing I'll say about the employer environment. So one is kind of aggregate cost increases. Two is fragmentation. The third is the need to better manage specialty care. It's most acute, the fragmentation issues are most acute when you have a kid with autism or you're diagnosed with cancer and there's a real lack of knowledge and the physician will only spend 5 minutes with you. And so that's kind of the issue that we're dealing with. And Cortica is an investment that we did in the autism space. And next week we'll announce an investment in Time Care, which is in oncology. And so those are kind of some of the issues and how we're addressing them. I'll say that like one of the nice things about coming into this environment for a couple of days is starting to understand the kinds of things that you are doing with John and Aegis, and everything that you're doing to drive better efficiency, better use of data, from a clinical perspective is highly related to what we do. We invest in a later stage. So we're investing generally in B and C rounds and helping to accelerate companies from the time that they have like a dozen customers to when they're going to go public. And that's kind of our role. And then we're also very focused on the employer markets as opposed to Medicare and Medicaid, which I think is kind of useful from where we stand. But we absolutely have to find better productivity through AI. And I'll say that the productivity will have to be shared with patients. It can't just sit at the health system level. And so by improving the patient experience and then also passing on cost savings to employees, I think it's going to be so important. I mean, one thing is like the unsustainability of the cost increases for business, but that's not nearly as pivotal as the unsustainability of the cost increases for patients. I mean, it's not only eating up salary increases, it's also kind of eating into them. And unless we're able to kind of translate that back, and so part of what we're focused on there is care navigation. So our investment in Embold, and I think some of the work that your portfolio companies are doing is very focused on that, and we're excited about kind of getting to know better. And then last thing I'll say is just what I said before, which is that clinical partnerships are key for us. Like one of the things that is foundational to our work is that we're very, very collaborative. We know what we don't know, and we don't have clinical expertise on staff. We always partner to get clinical expertise from our portfolio companies, and so we're really very open to partnership of kind of mutual interest. And so just want to encourage you, if you think about what we're doing here with respect to the employer space, when it starts to become relevant to the things that you're doing, please, our door is open always.